and I will go over a list and describe the gross and anatomical feature of the spinal cord. So spinal cord start from the foramen magnum of the occipital bone, and the rostrally, we call not superior or inferior, we call rostrally. Spinal cord extend from medulla oblongata of the brain stem and then exit through the foramen magnum and ends at the L1 or L2 lumbar vertebra and runs in the vertebral canal. Okay. The both brain and spinal cord had several layers of protection, and one of the protection is meninges. Okay. So we will talk about the 3 layers of coverings of the spinal cord, and we will compare with the brain at the same time. And these coverings are the meninges, cerebrospinal fluid, and surrounding vertebra. So from outside in, you have vertebra, then you have meninges, and under the meninges, you have CSF. And inside the spinal cord and inside the brain, also you have CSF. So the fluid gives the buoyancy of the brain and spinal cord. Basically, your brain and spinal cord are floating in the fluid, and we will see that. And then once we are done with the gross and microscopic structure of the spinal cord, then we will talk about the brain, development of the human brain today, and we'll correlate some clinical application. Okay. So we will start with a clinical application today. Among 2 veterans returning from Iraq War, one was paraplegic and another was quadriplegic. Explain the relative location of the injuries. So before I go, I want to write some of the terminologies here. So you see the terminology. This is paraplegia, then quadriplegia. Sometimes quadriplegia, doctors, clinician write it usually. Like layman people, other people write it quadriplegia, but doctors, physician, they write tetraplegia. Tetra means 4. So terminology: tetraplegia, hemiparesis, and hemiplegia. So what are these terminology? Our case, like 2 gentlemen has suffered trauma during the service, and one has paraplegia, another has quadriplegia. So we'll see how, in which region of the spinal cord damage will cause paraplegia and which one will cause quadriplegia, and why it is logical. But before that, there is terminology. Paraplegia means you have loss of sensation and motor activity only in the lower limbs, both legs. Okay, paralysis in the both legs is paraplegia. Quadriplegia is paralysis of all the limbs, 2 upper limbs, 2 lower, so there are 4. That's why you call them quadri or tetraplegia. Hemiparesis. Hemiparesis is like half of the body, either right side of the body or left side of the body. It's partially paralyzed, partial sensation loss. Okay, that is hemiplegia. Hemiparesis is like very minor. Like sometimes you see some people get damage and there is like slightly weakness in the one side of the body, but slowly they gain it. That is paresis. Paresis is like mild. Paraplegia is like severe, but they are the same thing by definition. One half of the body has paralysis. Are you guys following me?
Is that like when a person gets like a stroke and half
Yep,
of the
yep,
body?
yes. So like once somebody get a stroke in the right side of the brain, then they get left side paralysis, that is left hemiplegia. Okay, okay. So let's start with the central nervous system. What are the two major part of the central nervous system?
Brain and the spinal
Brain and
cord.
spinal cord.
Brain, the spinal cord. Because central means in the axis of the body. You know, brain is in the center and the spinal cord is also center of the body. That's why you call them central nervous system. So central nervous system contains the brain and the spinal cord. Brain lies in the cranial cavity, and brain is squeezed. That's why there is enfoldings, furrows, and bumps. Big brain has been squeezed in a small cranial cavity. That's why it is encased. And then spinal cord is the extension of your brain through the vertebral foramen. Okay. When you use the terms which is anterior or posterior or front or back or proximal or distal of the brain part, we use rostral and caudal. Rostral is towards the node part. So let's see if we compare the cervical spinal cord and lumbar spinal cord. Which one is rostral?
The
Oh.
cervical.
The cervical, yes. And the lumbar is caudal when we compare them, okay? The spinal cord function. So brain is the main, brain and spinal cord. When we divide the nervous system into the central nervous system and peripheral nervous system, peripheral nervous system is the transmission activity. It takes the information, it brings the information, it is like a highway. Sensory pathway takes the information to the brain and spinal cord, and motor pathway brings the information out from the brain and spinal cord. Okay, so spinal cord and brain basically is the association, command center of the nervous system, integration of the nervous system, decision-making area of the nervous system. That's why they contain most of the neuron cell bodies. And peripheral nervous system usually, mostly 90% time contains only axons and dendrites. Are you following me? So the spinal cord gives the attachment to the spinal nerves. So all spinal nerves exit from the spinal cord through a opening between the vertebra, and that opening is called, look, you have to, this is called how you integrate the learning and you remember for longer. Here you have to remember when you studied spinal cord and there was intervertebral foramen, means foramen opening between the two vertebrae. So spinal nerve exit from spinal cord through the intervertebral foramen. What is that called? Intervertebral foramen. Okay. So all the spinal nerves are attached to the spinal cord, provides two-way conduction pathway, means sensory pathway enters the spinal cord and then sometimes it does function locally in the spinal cord or it goes to the brain. And motor pathway from the brain and spinal cord comes out, okay? So provide two-way pathway, conduction pathway for the sensory and motor system. There is major center for reflexes. Reflexes is the action carried by our body without planning immediately. For example, when you see a rattlesnake in front of you hissing in the garden, are you going to think, oh my God, this is the rattlesnake going to bite me? It is poisonous. It's going to kill me and I'm going to die. That's why I have to run. No. Immediately what happens? You get back, and that is reflex mechanism. So to think and then act, it takes time because it goes to spinal cord, then to the brain. Brain decides, comes motor, then it takes time. In this case, you don't. It goes sensory in the spinal cord, and vision immediately comes to the spinal cord and gives the reflex action. Same thing when you are walking and you step on spikes, you immediately pull your leg. And that is not the decision of cerebral cortex. It is decision of spinal cord. And that is called major central for reflexes are here in the spinal cord. Okay. Location of the spinal cord runs through the vertebral canal, extend from foramen magnum to the level of the vertebra L1 and L2. Okay, so let me ask somebody here. A lot of you just turn on and don't attend. Jackie, are you here, Jackie?
Yeah, Professor, right here.
Okay, so foramen magnum is the opening in which bone of the skull? Foramen magnum.
Is
Through
it
which?
the vertebra?
Foramen magnum is the opening
Occipital.
in which bone of the skull? The largest opening in the skull was foramen magnum, and that was hole in which bone?
I'm sorry, Professor, I'm not sure.
It is in the occipital bone. So from the occipital bone, it extends from the foramen magnum in the occipital bone to the level of vertebra, L1 and L2. L1 and L2 means lumbar 1 and lumbar 2 vertebra. Okay. Okay, now a spinal cord has several regions, and we need to know that. There is naming of the spinal cord. So spinal cord and spinal nerves region are named after the vertebra. And what are the vertebra in different region? Let me ask again somebody. Anthony, are you here, Anthony?
Yeah, I'm here, Professor.
Okay, Anthony, go ahead. So what are the region of vertebra in our vertebra?
I don't know.
You don't know the name of vertebra?
Cervical,
Like
thoracic, and
backbone,
lumbar.
which are the vertebra in our backbone?
By sections, you want them?
Yeah,
Cervical, thoracic.
Cervical, thoracic, and lumbar.
Lumbar, sacral.
yeah. So in the neck region, the vertebra is called cervical vertebra. In the chest region, that is called
Thoracic.
Thoracic.
thoracic vertebra. In the abdomen region, that is called lumbar vertebra, sacral vertebra, coccyx vertebra. And our spinal cord name is also after that. Okay. So we're going to see that, and then we're going to learn about these structures. The conus medullaris, filum terminal, cervical and lumbar enlargement, cauda equina. I'll come back here, but I will go to a spinal cord first. Here you go. So you see there is opening in the skull through the foramen magnum, and then a spinal cord is coming, and then it ends at the
Please.
lumbar 1 or lumbar 2. And then we have, this is cervical spinal cord and cervical spinal nerves in this area. Here is a spinal, thoracic spinal cord, and nerves coming out of this is thoracic spinal nerves. Then in lumbar region, you have lumbar spinal cord and lumbar spinal nerves. And then sacral spinal nerves. And in coccyx, there is not coming anything. That's coccyx filum terminal. Okay. Now, if you see the spinal nerves are coming outside here in every level, you see. So we call it spinal nerve 1, 2, 3, and we will have 31 both sides. So 31 pairs of a spinal nerve. But if you see the spinal cord diameter, you see the yellow? They are not the same diameter all over. In some area, they are thicker, and in some area, they have less diameter. So the area which is enlarged, we call them enlargement. In the cervical area, you have cervical enlargement. In the lumbar area, you have lumbar enlargement, but in the thoracic, you don't have any enlargement. So you have lumbar enlargement. And then at the end, spinal cord is like tapered. So from this area, it goes and tapers. Tapering is here, and that becomes like a cone of the ice cream. And that's called conus, and medullaris is the spinal cord's another name. So cone of the spinal cord, conus medullaris. Are you following me? Then the spinal nerves from above, from the thoracic region, lumbar region, they come down as like hair coming down, and they look like the hair in the tail of the horse. And that's why the bundle of spinal nerves, we call it cauda equina.
Professor, why only the cervical and the lumbar are enlarged?
I'm coming there, okay? So in cervical enlargement, because from the cervical region, you have to supply a lot of neuron far away from here in the upper limbs. So to give a lot of spinal nerves and make a plexus, brachial plexus to the upper limb, that's why you have cervical enlargement. And then from the lumbar region, a lot of spinal nerve exit from your spinal cord, make a bundle like sciatic nerve and goes to your lower limbs. That's why they have enlargement in the cervical and lumbar area. Okay. Then the central fiber continues in the coccyx, and that is called filum terminal. They are like very film, tiny thread-like structure. That's why we call them filum terminal. Okay, so these are the terminology. We're going to go again. So conus medullaris is the inferior end of the spinal cord, which are cone shaped. Filum terminal is long filament of connective tissue attaches to the coccyx inferiorly. So inferiorly, it is attached to the coccyx. Cervical and lumbar enlargement, where nerves for upper and lower limbs arise. That's why they are enlarged. And cauda equina is collection of spinal nerve roots. Okay, and they look like they look like the hair on the horse tail. That's why we call it cauda equina. Cauda means, in Hispanic, cauda means horse. Tail. And equina means horse. That's why we call it cauda equina. Okay. So how many spinal nerves we have here? 31 pairs of spinal nerves. Now question comes, these spinal nerves are sensory, motor, or mixed?
Mixed.
Mixed, because sensory nerve fibers are going inside and motor are coming, and both are bundled together. That's why they are mixed nerve. And that's why definition of nerve is bundle of axons in the peripheral nervous system. Are you following me? So nerve is bundle of axons in the peripheral nervous system. And if you have similar bundle of axons inside the spinal cord, inside the brain, then we call them tract. Ascending tract, descending tract, and other tracts in the brain. Okay? Whereas group of neuron cell bodies, soma, in the brain or spinal cord are called nuclei, and they are called ganglia in the peripheral nervous system. We have done that in first lecture too, I believe. Okay, let's see the diagram of the spinal cord now. So two deep groups runs through the spinal cord. So if you cut the spinal cord at any level, like thoracic level, lumbar level, you're going to see the internal structure of the spinal cord. Okay, so spinal cord has posterior median sulcus and inferior median fissure. So let's see transverse section of the spinal cord. This is the posterior because spinous process is posteriorly and body is anteriorly. So you guys look at it and try to understand. And if I ask question from this diagram, you should tell, you should know, pay attention. Without active learning, it is always hard to grasp everything. So you need to be focused. Okay. So here is in the center. This is the spinal cord. We have two half sphere of a spinal cord. You see here, this is the left half. This is the right half of the patient, not yours. Okay. So this is the left half. This is the right half. And in the center, left and right half is communicating. Okay. You see outside of the spinal cord is white looking structure, and in the center there is dark gray looking structure. All come here later. Now, the protection of the spinal cord is like protection of the brain. So you see here, you have first vertebra. This is the spinous process, this transverse process, this is the body of the vertebra. And then you have fatty layer. And then spinal cord is covered by 3 layers of meninges, spinal meninges. Similar meninges will be in the brain too, we'll see in coming slides. So the 3 layers of meninges, the outermost layer is
Dura Mater.
Dura Mater, which is called spinal dural sheath. Okay, Dura means in Spanish, Dura means tough.
Tough.
Mater
Strong.
means mother. So it is a strong, thick mother. That's how it called. It's very dense connective tissue. Then there is arachnoid. Arachnoid is like wispy like a structure. You see there is a white layer surrounding the spinal cord, and then their tentacles, their foot are attaching. So they look like wisp or spider, wispy looking. That's why we call them arachnoid matter. And then very thin, delicate, soft, pia means soft, thin, soft mother. That is called pia matter. It is pia matter which is attached intimately to the brain surface of the spinal cord surface. Okay. Now, between these meninges, there is a space, and we call them different space. So space outside the dura mater is called epidural space, and this space contains fat. Now, a space between the dura mater and arachnoid mater is called subdural space because it is under the dura mater. Subdural, epidural. Now, the space between the arachnoid mater and pia mater, which is the most spacious space, it has like larger space, and that space is called subarachnoid space. The subarachnoid space contains CSF, brain fluid. CSF means
Cerebrospinal fluid.
cerebrospinal fluid. The cerebrospinal fluid is filtrate of your blood. It contains same water, but it is aqueous, thinner. It has less protein, all the electrolytes, less potassium compared to your plasma. And this gives buoyancy effect on the brain and spinal cord. Okay. So now let's go over the structure of the brain. So this is white matter and gray matter, and we're going to talk about that. Now, you see from the posterior part, some of the axons is coming in and going out. From the interior side also, some of the axons and dendrites are coming in and coming out, going out. And this is a spinal. Here, dorsal root ganglion, that means some of the cells are, neuron cell bodies are lying here in this bump. And this is dorsal root sensory ganglion. And so when they mix, we call this a spinal nerve, and then the spinal nerve divide and becomes ramus. This goes dorsal ramus, and anterior is ventral ramus. So now the white looking structure in the brain and spinal cord is called white matter, and gray looking is called gray matter. So what is outside, gray matter or white matter in the spinal cord?
White matter.
White matter. And gray matter is in the center. In the brain, it is just opposite. Gray matters are in the cerebral cortex, outside of the cerebrum. And white matter is in the middle. And there are here and there scattered some of the gray matter in the middle too. Okay. So let's see how these columns, like these columns of the white matter and the gray matter, functionally are different from each other. Here, this side we have white columns, and this side we have gray matter. Let's talk about first white columns. And this slide is the most important slide for the next exam, because you will see a lot in the lab, in the lecture. Think of your spinal cord now. So white columns, 1, 2, 3. We have 3 white columns. This is towards the posterior, yes? So you have dorsal median sulcus, and this is deeper, so we call them ventral median fissure. If you see your brain, the fissure is anteriorly more pronounced compared to posterior, because posteriorly we have cerebellum. So anteriorly is the fissure and posterior is the sulcus. To remember, I'm just making connection. So first, let's see the columns. White columns, dorsal or posterior column. Another name for columns are funiculus. Okay, there is nothing like hard about it. It is just another name for column is funiculus. Then we have anterior here, or ventral funiculus, and then you have lateral funiculus, and these all are white columns. Now let's go to the gray area here. Gray area has here gray white matter. We have posterior or dorsal horn. Then we have lateral horn, and we have ventral or anterior horn. Why it is important to know these all area? Because they have different function. That's why it is important to know them. Are you following me? So I'm going to explain it again, but I want to tell you here. So let's see if I touch, when you touch your finger, pinch your finger now and feel the pinching. So when you pinch, what happens? The dendrites of the pseudo-unipolar neuron, which cell body is here in the dorsal root ganglia, dendrites come here, and then cell bodies are here. Then axons goes to the here, dorsal posterior funiculus. And then it takes to the brain or spinal cord, wherever it needs to go. Are you following me? Similarly, the visceral area will come here, and all sensory. So dorsal root ganglia has sensory neurons. Dorsal root sensory, ventral root and ventral root are motor. They are coming from here. So the motor area. Okay. So this is the dorsal root ganglia, ventral root, and when they combine, we call them spinal nerves. So this is dorsal root, rootlets are sensory, ventral root and rootlets are motor. And when sensory and motor mix, that becomes spinal nerve. And that's why I called earlier, spinal nerves are mixed nerve. And these nerves again exit through the intervertebral foramina. And you can see again, dura mater, arachnoid mater, pia mater. You see, sorry, under the arachnoid mater, you see a lot of blood vessels. So under the subarachnoid space, there is a lot of blood vessel. In some people, if there is a high blood pressure, these blood vessels rupture and bleed inside the subarachnoid space. And that causes paralysis, that causes death, and that bleeding is very painful. You can not feel any pain like that. It's called the worst pain of the life.
Professor, did you say that was from high cholesterol or sorry,
high blood pressure? Okay, so again, in the spinal cord, organization of gray matter of the spinal cord. Let's see here. First, I'm explaining the same thing again. So SS is interneuron receiving input from somatic sensory neuron. So SS means somatic sensory neuron. This is blue. Then you have another color here. Interneurons receiving input from visceral sensory neuron. So you see posterior area is all sensory in the gray matter. Now anterior horn, the yellow one is visceral motor, means motor neuron from here goes to the visceral organ like your heart, your lungs, your urinary bladder, uterus, cervix, all the internal organs. And the ventral horn of the gray matter goes to somatic motor. So somatic motor is motor neuron to skeletal muscles. Let's see here now in the left side. Let's talk about sensory first. So as I said earlier, this is dorsal root ganglia. You have cell bodies of dorsal, sensory neurons in the dorsal root ganglia. So somatic sensory neurons, axons, or dendrites are coming here, carrying the sensation from your finger or body. Then their dendrites goes here, and synapse is the another interneuron in the spinal cord, and that lies in the dorsal horn. And then from there, it brings the reflex, or it connects up in the spinal cord and goes to your brain. Similarly, visceral sensory neuron. Visceral sensory neuron means these neurons are bringing sensation from the visceral organ, like your heart, your lungs, your urinary bladder. So they also bring here, and their sensory neuron cell bodies are here, but it goes here in this area, slightly medial. Okay. And then again, it takes to the brain. Similarly, motor neurons cell bodies are in the either lateral horn or ventral horn. Lateral are autonomic neurons. So their axons then takes the impulse, visceral motor neuron, to the body, like your heart, your lungs, your GI tract. And then some motor neuron, which is most anterior, they take the motor neuron axons to the skeletal muscle. Are you following me? So in spinal cord, the summary is in spinal cord, different region has different kind of the white matter and different kind of gray matter responsible for different kind of function. And they are organized based on whether it is sensory from the body wall or sensory from the visceral organ, and motor from the body wall or motor to the visceral organs. And this visceral motor yellow part is called autonomic nervous system, and they have two divisions. The two divisions are
It's sympathetic.
sympathetic and parasympathetic. Did you get it? Anybody has question here? This is slightly demanding.
I have a question.
Go ahead.
So more in the greater picture, because this is just a segment of one spinal nerve going up the spinal column. Does this repeat in that same pattern where you have
Yes,
neurons?
yes, exactly. Yes. So like, let's see if I have a sensory from the finger, that will be in my here, lower part of the cervical region. If I have from, let's see, my tummy area, sensation is coming from my navel area, then it will be in lumbar region, but the same thing.
Okay. And there's no gap in between it. Like,
No.
It's not segmented. It's just the gray matter is continuous all the way up.
Yes, gray matter and white matter, everything is continuous. It is a column.
Yeah.
It is a column everywhere, exactly the same structure. There are slightly changes in different region, but you will see out white matter in gray matter.
Okay. And is it through, it's through the white matter that the signals go up to the brain, correct?
Yes, yes.
Okay. So like to bring into a greater picture, the stimulation comes into the gray matter, and then from the gray matter, the axons branch off then and then send the signal up?
Yes, so let's see here.
Okay.
Like, let's see the visceral sensory neuron coming here. And its synapse here, interneurons. And then this interneurons fibers, if it needs to go to, like, let's see a heart rate we have to control, it must go to our medulla, our medulla oblongata in brainstem. So what happens? This neuron synapse with another neuron, or there the axons then goes up through the ascending tract.
Okay.
To the brain. Are you following me?
Yeah.
And then brain will decide, we have to increase the heart rate. So then same, the tract will down in the white matter, because this is the cell, so tract becomes here, and then tracts come down to the heart now again. So there is tracts, like wires going up, coming down, all the cables.
And then as far as the tracts, are the dorsal and ventral and lateral funicules?
The tracts, yes.
But
They form the tracts.
are the ascending and descending tracks within each of them, or are they
Each of them, they
okay.
have like, when there is ascending tracts means sensory tracts, descending tracts means motor tracts.
Okay. Understood.
Okay, so protection of the spinal cord, protected by vertebra, meninges, and CSF, and we talked about it. So let's go here. I have compared, this is not in your slide, I think. I added here to compare, just to compare, and we will go over in next slide. We have this slide from upcoming lecture. So you saw here the protection of the spinal cord. Protection are bone, meninges, CSF, and there is one inner protection too. And that is the blood-brain barrier. Do you remember that? The blood vessel of the brain endothelial cells have tight junction, and that is covered by astrocyte food process, and that creates blood-brain barrier. So the bony protection, meningeal protection, and then CSF protection, and then lastly, the blood-brain barrier. This all protects the delicate structure of the brain from outer toxic substance or microorganism. So let's see meninges in the brain. This is the brain area here, and this is your skull. And we are cutting the skull and looking here. So you have a skin of the scalp, you have the periosteum, outer connective tissue of the skull bone. And then under it, you have periosteal, another periosteum, because any bone, compact bone has always periosteum either side. So you have periosteum both side. And then under the periosteum, you have dura mater. So what is difference here? The dura mater here is not attached to the bone in a spinal cord. That's why you have epidural space. But in brain, dura mater is fused with the periosteum of our skull. So there is no space, epidural space. And these epidural space will be only in certain location where there is venous sinusage. Okay. Now under that, there are all the same meninges. You see here, the dura mater, arachnoid mater, pia mater. It is only pia mater which runs through the surface of the brain. You see, it runs through the sulcus. Oh, it runs through the sulcus, you see, and then gyrus, sulcus, gyrus. Okay. And this is subarachnoid space. And inside the subarachnoid space, you see there is a lot of blood vessels. This space contains a fluid that is called cerebrospinal fluid. So these are the protection of the brain and spinal cord. Cerebrospinal fluid fills the hollow cavities of the brain and spinal cord. It is like 120 to 150 ml of CSF every day we produce. And I think in 2 to 3 days, we replace them. Provide a liquid cushion for the spinal cord and brain. So you see, let me go here. Inside the brain, we have a cavity. And that cavity also contains CSF. When we talk about CSF in the brain, we will talk about that. So you have a brain or a spinal cord. You see the central hole here in the spinal cord. This is called central canal. In the central canal, you have CSF too. And around the spinal cord, you have CSF. Similarly, you have CSF in the subarachnoid space, and you have CSF in the cavity of the brain in the center, that is called ventricles. So your brain and spinal cord is pretty much floating inside the fluid. You have outside fluid and you have inside fluid, and then you have brain and spinal cord. So that gives buoyancy of the brain and spinal cord. That's why you feel like very lighter weight of the brain and spinal cord. And let's see, if you take somebody's fresh brain and let's hold it and throw on the ground, it will splatter everywhere. That brain is so soft and gooey. So every time you move your head, your brain is moving, but there is cushion of the liquid from inside and outside. And that takes all the force and protects your brain. That is a big protection of the brain. If you lose CSF, your brain gonna start affecting immediately. But when you have a body dehydration, you never lose the amount of CSF. They are always normal amount. Only blockage to the flow can increase or decrease the amount, okay?
If it's increased,
Yeah, that's hydrocephalus. It happens with the disease if blockage.
okay.
Okay, so this fills the holoca, provide liquid cushion for the spinal cord and brain. Other function are they nourishes brain and spinal cord. They remove waste. They carry chemical signals between parts of the CNS. They provide some nutrition when needed. They contain some glucose, some protein molecules, so provide nutrition and maintain chemical homeostasis of the brain and spinal cord. So if you have infection of the brain and spinal cord, we call it infection of the brain is usually from outside. So if any of these meninges, Dura Mater, Arachnoid Mater, Pia Mater, they get infection, particularly the dura and arachnoid, we call them meningitis. And if there is infection of the brain tissue inside, then we call them encephalitis, okay? And in that case, you have to take a spinal cord fluid, CSF, and you take that CSF from in between L4 and L5. Do you know why? Because if you go up above, that will kill the spinal cord. That's why you have to take from here. And then you take this CSF and diagnose, find what is the bacteria in the CSF, if there is chemical change in the CSF. So you have to remember where you take that from. Now, some parts of the brain performs the most complex neural function like intelligence. Intelligence means association, recalling, judgment, conscious level, memory, sensory and motor integration of the sensory and motor neurons involved in innervation of the head like cranial nerves. These all are the function of brain. Calculation, judgment, emotion, all are the function of the brain, okay? Now let's talk about the embryonic development of the brain. Brain develop from a neural tube. So let's see here first. During the fertilization, egg and sperm here fertilize, and then that becomes zygote. This zygote then implant on your uterus wall, and then it develops. When it develops, there are three germ layers: ectoderm, mesoderm, and endoderm. This is ectoderm, which forms the neural tube. You see, neural tube has outer part, the cells, and in the center, you see the green area, blue area, that is the cavity filled with the fluid. By the third week of gestation, this tube enlarges in the rostral part. And the first enlargement is called prosencephalon, second is called mesencephalon, and third is called rhombencephalon. And that is the forebrain, midbrain, and hindbrain. By the fifth week, forebrain further divide into two, telencephalon and diencephalon. Mesencephalon, midbrain remains the same. Rhombencephalon or hindbrain also divide into two, which is metencephalon and myelencephalon. You see only the tube wall is increasing inside. Inside you have still the cavity and fluid. Now adult brain structure. This telencephalon, you see the gray color, they form all cerebral structure, cerebrum, the most highest part of the brain. Cerebral hemisphere, cortex, white matter, basal ganglia. And then middle part here forms the diencephalon. Diencephalon gives you hypothalamus, epithalamus, and thalamus. Mesencephalon contains part of the brainstem, which is midbrain. Metencephalon gives another part of the brainstem, that pons and cerebellum. And myelencephalon, these are the big names, so you have to write down several times to understand them. That is brainstem, medulla oblongata, and then continuous yellow part is the spinal cord. At the same time, in the central part cavity, here, cavity in the telencephalon is lateral ventricle in the both ventricle, the cerebrum. The cavity in between the diencephalon from both hemisphere of the brain is called
Third ventricle.
third ventricle. And then third ventricle continuous with the fourth ventricle through a very, here you look, it looks big, but it is like here, like opening. That is called cerebral aqueduct. And then between the brainstem and cerebellum, here is another cavity that is called fourth ventricle, and same continued in the spinal cord that is called central canal. Okay. So if you see the brain, adult brain development, we have two hemispheres. The upper part is called cerebrum. Inside the cerebrum, there is basal ganglia. And then when you take out this upper part, cerebrum, or we call them cerebral cortex, or we call them cerebral hemisphere because we have two hemispheres, right and left. Inside you have diencephalon. Diencephalon has thalamus, epithalamus. And this area, small area, is hypothalamus. Epithalamus will be here. And then posterior part, and then this is the brainstem. Brainstem has three parts. Middle between the diencephalon and brainstem, this midbrain. This is like bridge-like structure pons, and then medulla oblongata, and together we call them brainstem. And here behind will be cerebellum. Okay, so these are the structure in the
Brain.